Hello, welcome to 8.9 News. I'm Finlo Costain. Today's headlines: new government funding for farmers to protect the English landscape. The Public Health Collaboration Conference will link land use and metabolic health. And BP targets farms and feedstock in the biofuel race. This weekend, the Public Health Collaboration will hold an international metabolic health summit featuring world-leading experts. The conference will address aspects of metabolic health and debate the types of food that land in the UK can best produce. Sam Feltham is the director of the Public Health Collaboration, and I asked him whether he thinks that government nutrition guidelines are fit for purpose.
Yes, oh well, I wish that was the case. But unfortunately, the reason that we set up in the first place was because we essentially disagreed with current healthy eating guidelines, and we thought that there's improvement there needed, basically. So the PHC it's a collaboration of GPs, nurses, dietitians, researchers, all trying to help improve nutritional guidelines in order to improve the metabolic health of the nation, which would then improve the many chronic diseases that we're all having to deal with on a daily basis, whether it be type 2 diabetes, cancer, cardiovascular disease, Alzheimer's. All of these can be largely prevented by having good metabolic health.
So it's about trying to sort of share knowledge and make sure that the science that people are working with is as up to date as possible, and therefore potentially influence public policy going forwards.
100%. That's exactly it. And we know kind of from the research that there's about a 17-year lag from research to guidelines being updated. And we're just trying to speed up that process.
Now, we're here talking about land use. So I wonder, how does public health link to land use in your view?
Yes, I mean, in terms of the linkage there, health and food are very much linked. And in terms of like the actual usage of the land, the higher the food quality, the better the health of the people. So it's absolutely vital that we have proper land use policies in place so that then we can get the most out of public health.
So this is about trying to influence food supply chains so that the right sort of food is being grown in the right way to supply the market across Britain and potentially elsewhere that provides the nutrition that people need.
Yes, exactly that. And public health is massively broad, and it goes everything from the environment and air quality to kind of the types of foods that you're actually eating. So that's a massive piece of the puzzle. And if we have happy land, we have happy people.
So land is one of the issues you're going to be covering at the conference. What other issues are you likely to be addressing this time round?
Yes, so some of the big ones are how do we actually tackle the type 2 diabetes issue. So just to give a bit of perspective for people, type 2 diabetes is the most expensive chronic disease. For the NHS, it costs £10 billion per year, but it is largely preventable through improving people's lifestyles and improving their metabolic health. And we have a way to try and scale that up. So we're going to be presenting how we do that, and that would take a massive burden off of the NHS and go a long way to helping fix a lot of issues that the NHS faces. In addition, we're going to be tackling food addiction as well, particularly on the Saturday morning, through a panel with many leading experts from around the world on how to overcome food addiction, because we live in a world where ultra processed food is absolutely everywhere, and people are addicted to these things. Those companies manufactured those foods to be addictive so that you buy more and eat more. So yeah, trying to overcome that is a massive issue. So that's one that we're tackling.
Meat has been in the crosshairs, of a lot of public health professionals and policymakers over the course of the last few decades. Is meat really as bad as people make it out to be?
Certainly not. No, it's a highly nutritious food that's been part of our evolutionary history for millions of years, and all of a sudden to think that it's causing lots of chronic diseases and isn't good for us full stop is just, it's a modern invention, that idea, I think. Yeah, we're trying to right the ship when it comes to that, for sure.
Now, just finally, what sort of people, who's going to be at the conference, and what are the outcomes that you think you might achieve through running the conference?
Fantastic. Yeah, so what's amazing about the PHC is that it is all about collaboration. And so ever since we started in 2016, it's always been about 50% healthcare professionals, 50% passionate members of the public. So it's about that balance this year. And the outcomes that we want is to raise awareness about the potential we have as a society to fix the issues that we're facing right now in terms of healthcare, and public health statistics when it comes to, almost 4 million people living with type 2 diabetes, almost 30% of people living with obesity, and a quarter of deaths from cardiovascular disease, and all of these things we can massively reduce through improving lifestyle and improving our metabolic health.
Now, the conference is over 2 days at the end of this week, Friday and Saturday. It's at Sheffield Crucible. Are there any tickets left? Is there the opportunity for people to turn up on the day?
Yes, there are tickets left. Unfortunately, the Friday evening dinner is completely sold out. So there is still the chance to attend during the day, though. However, if you're not able to actually come to Sheffield, we do have a live stream option as well. So you can kind of watch in the comfort of your own home, and then you'll get those recordings to keep forever afterwards as well. It'll take us a couple of weeks to kind of like do the edits and things, but you'll be able to kind of scroll back through the actual live stream for a couple of weeks whilst we're busy editing.
And those will be on the Public Health Collaboration website?
Yes, yeah, all of that's available through there.
That was Sam Feltham from the Public Health Collaboration. More about this and our other headline news on our website, 8point9.com. That's all for now. We're back on Monday. Thanks for watching.